Probable measles are now reported in Oklahoma. Both of these cases are being traced back to ongoing outbreaks in Texas and New Mexico. The state health department says the patients do not pose a public health risk, but did previously send out a health alert network message advising clinicians to consider measles when patients have certain symptoms. We are joined now by pediatrician Dr. Devin Hahn with OU Health. So, Dr. Hahn, how do doctors decide when to consider or rule out measles?
Right now in this setting, if a patient comes in with the constellation of symptoms, fever and rash, of course they're going to consider measles. The main thing to remember is if you think it's measles, then either isolate at home and call your doctor's office and run through those symptoms with them, or if they're in your office as a provider, then isolate them from other people, because measles is just so contagious. If somebody walks in a waiting room and even leaves that waiting room, they're going to be exposed for the next 2 hours. And so anyone in that waiting room will have been exposed, and those unvaccinated are at highest risk.
And we know that it takes many days possibly to see those symptoms pop up after being exposed. So are people at risk of spreading this virus even before they know they have it?
Yes, they are. So if you are exposed to measles, you may not have any symptoms, but you still are infected for 1 or 2 weeks. You're infective for about 5 days before the rash appears and 5 days after the rash appears. And so you may not have the symptoms before you realize that you have been infected. So you could be exposing other people.
I understand that the State Department of Health is having to send our tests to Minnesota to get confirmation that the cases here in Oklahoma are actually measles. How do you confirm a case if you suspect it?
The first thing that I would do, and I recommend all providers do, is call the State Department of Health. They are going to guide you through how to do the testing and where to send it. I don't know exactly where they're sending tests. There are some that are out of state, but right now they will tell you how to collect the swabs. You can do all sorts of testing. You can do nasal swabs. You can do the inside of the cheek swab. You can do urine. You can do blood tests. But the state health department can tell you where those swabs need to be sent.
So let's talk about how serious this can be, because I've seen a lot of misinformation on the internet, people comparing it to chickenpox. Talk about who is most affected by this and how dangerous it can be.
Well, thank you for this opportunity, because it is very important to know. Measles is probably the most infective disease that we have, and we eradicated it from the U.S. back in 2000, but with travel and non-vaccination rates going up, it really has become more of a problem. So here's some statistics. Like I said, it lingers in the air for a couple of hours before it dies. If a person is unvaccinated, then they are very high risk of getting it. 9 out of 10 unvaccinated people exposed to measles will get it. It's a serious disease. It causes a lot of morbidity and mortality, meaning it causes a lot of different consequences and other illnesses like pneumonia and encephalitis. That's a brain infection. You can have sequela on down the road for 20 years from having measles. And then the death rate is high with measles. So it's about 1 to 3 in every 1,000 people that are infected. And we can already tell that because we've had 2 deaths and just about 220 people who have been confirmed in Texas and New Mexico.
Yeah, one of those deaths we know was an unvaccinated young child. So are children at particular risk with this?
Yes, children under 5 are more at risk. People over 20 years, pregnant women, and then people with compromised immune systems.
All right, so is this a good time to make sure that we are vaccinated? I know we can go online and check our records, ask your parents. Is it too late to get our children vaccinated if we maybe missed that opportunity when they were babies?
A good point. Vaccination is the best way to prevent getting measles. So after 1 dose of the MMR vaccine, that's the measles, mumps, and rubella, you are 93% protected against the measles within about 2 weeks of having had that shot. If you've had the 2 doses, then you are 97% protected against measles. So getting the vaccine is the most important and best way to prevent against getting measles.
All right, Dr. Hahn, an incredibly important topic right now, especially for those of us with children. We appreciate your help.